Introduction. Welcome, medical students, to today's lecture on autonomic neuropathy. In this comprehensive script, we will explore the intricacies of autonomic neuropathy, its pathogenesis, clinical manifestations, diagnosis, and management. Autonomic neuropathy refers to the dysfunction of the autonomic nervous system, leading to impaired regulation of involuntary bodily functions. Let's dive into the various aspects of autonomic neuropathy to gain a better understanding of its complexity. Autonomic neuropathy is a condition that primarily affects the autonomic nervous system, which controls involuntary bodily functions such as heart rate, blood pressure, digestion, and bladder function. It can occur as a result of various underlying causes, including diabetes mellitus, autoimmune disorders, hereditary diseases, and more. The pathophysiology of autonomic neuropathy involves damage to the nerves that regulate these functions, leading to disturbances in their control. The pathogenesis of autonomic neuropathy can vary depending on the underlying cause. For example, in diabetes mellitus, prolonged exposure to high blood sugar levels can damage the small blood vessels that supply the nerves, leading to nerve damage. In autoimmune disorders, such as Guillain-Barré syndrome, the immune system mistakenly attacks the nerves, resulting in autonomic dysfunction. Other potential etiologies include genetic mutations, drug-induced neuropathies, and metabolic disorders, among others. The clinical manifestations of autonomic neuropathy can be diverse and involve multiple organ systems. Patients may present with cardiovascular symptoms like orthostatic hypotension, arrhythmias, and exercise intolerance. Gastrointestinal symptoms, such as gastroparesis and bowel dysmotility, are also common. Genitourinary manifestations can include sexual dysfunction and urinary incontinence. Additionally, pseudomotor dysfunction may result in abnormal sweating and dry skin. Diagnosis involves a comprehensive clinical evaluation, including medical history, physical examination, and specialized tests such as autonomic function testing, sweat testing, and neuroimaging. Cardiovascular autonomic neuropathy, CAN, is one of the most clinically significant complications of autonomic neuropathy. It involves dysfunction of the autonomic nervous system's regulation of heart rate, blood pressure, and cardiac reflexes. Can lead to life-threatening cardiovascular events such as myocardial infarction, ventricular arrhythmias, and sudden cardiac death. The diagnosis of CAN includes various tests such as heart rate variability assessment, tilt table testing, and blood pressure monitoring. Gastrointestinal autonomic neuropathy refers to the dysfunction of the autonomic nerves that control the movement and function of the digestive system. This condition can cause various symptoms such as delayed emptying of the stomach, known as gastroparesis, impaired function of the esophagus leading to difficulty in swallowing, and problems with bowel movements like constipation or diarrhea. Additionally, it may result in malabsorption, where the body fails to properly absorb essential nutrients from food. To manage gastrointestinal autonomic neuropathy, doctors often recommend dietary changes, prescribe medications that enhance the movement of the digestive system, and use interventions to improve motility. Genitourinary autonomic neuropathy can cause bladder and sexual dysfunctions. Patients may experience urinary retention, incomplete bladder emptying, urgency, frequency, or urinary incontinence. Sexual dysfunctions can manifest as erectile dysfunction in men and arousal, lubrication, and orgasmic difficulties in women. A multidisciplinary approach involving urologists, gynecologists, and sexual therapists is often necessary for optimal management of these symptoms. In pseudomotor autonomic neuropathy, the sweat glands are affected, resulting in irregular sweating or reduced sweat production. This can cause patients to experience dry and cracked skin, especially in their hands and feet. Pseudomotor testing, which includes sweat testing, can be helpful in diagnosing this condition. The main goal of treatment is to alleviate symptoms and prevent skin damage. Autonomic neuropathy, a potentially devastating complication of autoimmune disorders such as Guillain-Barré syndrome, occurs when the immune system erroneously targets the peripheral nerves, leading to disruption in autonomic function. Timely identification and administration of immunomodulatory therapy play a pivotal role in the management of the underlying autoimmune disease and alleviation of autonomic symptoms. Prompt recognition of autonomic neuropathy and autoimmune disorders is essential for targeted interventions and improved patient outcomes. Autonomic neuropathy can also be seen in certain hereditary disorders like familial dysautonomia, also known as Riley-Day syndrome, and amyloid neuropathy. These conditions result from genetic abnormalities that impair the functioning of the autonomic nervous system. When dealing with these specific disorders, the primary focus is on managing symptoms and providing supportive care to improve the patient's quality of life. Autonomic neuropathy, a condition characterized by damage to the autonomic nerves, often leads to orthostatic hypotension. This occurs when there is a significant decrease in blood pressure upon assuming an upright posture, resulting in symptoms like lightheadedness, dizziness, and fainting. Managing orthostatic hypotension in patients with autonomic neuropathy involves a multimodal approach. Lifestyle modifications, including adequate hydration, avoidance of sudden movements, and elevation of the head of the bed, are recommended. Pharmacological interventions, such as fludrocortisone and midodrine, can also be prescribed. Additionally, physical countermeasures like compression stockings and leg crossing can help maintain blood pressure and alleviate symptoms. Autonomic neuropathy, a complication seen in diabetes mellitus, is characterized by damage to the autonomic nerve fibers. This condition can impact several organ systems and is associated with increased morbidity and mortality. Prompt recognition and diligent monitoring of autonomic neuropathy in diabetic patients are essential for effective management. Maintaining optimal blood sugar levels through glycemic control is crucial, as it can help prevent or slow down the progression of this condition. The management of autonomic neuropathy involves a multidisciplinary approach, addressing the specific manifestations in each patient. Treatment strategies focus on relieving symptoms, optimizing organ function, and addressing any underlying conditions contributing to autonomic dysfunction. This may involve medication regimens, lifestyle modifications, physical therapy, and close follow-up to monitor treatment response and adjust interventions as necessary. Autonomic neuropathy is a condition that affects the autonomic nervous system and can have profound effects on a patient's overall well-being. It is characterized by a range of symptoms that vary from person to person, making it important for healthcare providers to have a thorough understanding of its pathogenesis and clinical manifestations. By accurately diagnosing autonomic neuropathy and implementing a multidisciplinary approach to care, we can provide targeted treatments that alleviate symptoms and enhance patients' quality of life. Through ongoing research and advancements in treatment options, we are optimistic about improving outcomes for individuals with autonomic neuropathy.